Greater Manchester took charge of health and social care spending and decision-making 3 years ago, aiming to achieve the biggest, fastest improvement to the health and well-being in our region. We did this because we know good health and well-being are crucial to make our region a great place to grow up, get on, and grow old. We're proud of the progress we've made. More children are ready to start school. People are surviving cancer longer. More people have found and kept good work. Fewer people smoke. More people leave hospital on time when they are well. More people are physically active. And more children and young people are receiving the mental health support that they need. However, there is still more to do. It's the job of local public services, including the NHS, to work with individuals and communities, helping each other live the healthiest and most independent lives possible, and, with support from local services where needed, to help people live well at home. At the same time, we want the very best hospital services for those who do need more specialist care. Our Improving Specialist Care programme has been looking at a range of hospital services which we, the NHS and our partners, such as councils and voluntary organisations, believe could work more effectively as Greater Manchester-wide services if we're to get the best and most consistent outcomes for patients. This would mean sharing staff and expertise across different hospitals in the region. In fact, we already do this for some specialist services because we know it saves lives. For example, people who have suffered a major trauma are now taken directly to the hospitals specialising in handling this, and people who have a stroke now go to one of 3 specialist centres. The changes to these 2 services save around 220 lives every year in Greater Manchester. The areas we're now exploring as possible Greater Manchester-wide services are benign urology, which is non-cancerous disease of male and female urinary system and male reproductive organs; cardiology, which is the branch of medicine that treats diseases and defects of the heart; respiratory, which treats diseases of the lungs and structures associated with breathing; musculoskeletal orthopedics, which is treatment of muscles, bones or joints; paediatric surgery, which is planned surgery for infants, children and adolescents; in-hospital breast services; vascular, which treats conditions of the blood vessels, for example arteries and veins; and neurorehabilitation, which is treating injury or disease of the nervous system. We are working with doctors, nurses and a wide range of healthcare professionals to advise us on how this might look from a clinical perspective. Patients, carers, the community and voluntary sector are also sharing their views and informing us on what they feel is good about using specialist services and highlighting where we can improve. This collective thinking is helping to shape services for the future. More information on the Improving Specialist Care programme and the Greater Manchester Health and Social Care Partnership can be found at www.gmhsc.org.uk. To contact the programme team, email gmhscp.isc@nhs.net.